Hey guys, I'm so excited to come to you today with another interview. Today I have Courtney Kirkpatrick. She is a licensed professional counselor here in the Pittsburgh, Pennsylvania area. She is the owner and counselor at Kirkpatrick Counseling and Consulting, and she has agreed to talk to us today about trauma. So as most of you know, I am not a trauma certified therapist. And so I love talking to Courtney and picking her brain about, what she's seeing. And she agreed to come and talk to you guys with me today on all of these things. So welcome. Thank you for doing this.
Thank you for having me.
Sure. Okay, well, let's just dive in. Tell me, how do you define trauma?
Yeah, so trauma, the best definition that I can provide is basically any events, in our lives, whether it's, witnessed or perceived or discussed or talked about or, firsthand, experience, anything that prohibits us from basically like being able to cope with it. So something, this event that is completely outside of our realm to control or to cope is the easiest definition of trauma that I can provide. So
awesome. Okay. So then it sounds like it's probably safe to say that everyone, maybe not everyone, but most people have experienced something that they could define as trauma.
Yeah. And because like you're saying, because trauma is subjective, it's very unique, right? So it's almost like a fingerprint. What might be considered traumatic for me might be within your scope of being able to cope with it. So it's very subjective. And there's something that we call big T versus little t trauma.
Okay.
So big T trauma is the things that we would consider like the big traumas: natural disasters, war, combat, community violence, school violence. These are really big, events that take place. The other thing that we don't really talk about, but it's definitely something to consider, is what we call little t trauma. So that's something like, having a medical procedure that you weren't expecting, a dental procedure gone wrong, or a negative experience, a minor car accident, losing your job, transitioning to another job. So these little life events over time can give us the same kind of trauma symptoms that we would see in somebody that has big T trauma. So yeah, it's very subjective, and at some point in our lives we may deal with something just like that, whether it's a big T trauma or something little t trauma.
Okay, no, that's good to know. Okay. What would you say are some maybe long-term effects that you've seen of people who have trauma that maybe they didn't know they could get help or should get help, and they have lived with it for a long time? What kinds of things are they experiencing?
Yeah, so the things that we typically think of when we think about trauma symptoms is pretty across the board. So you might experience intrusive thoughts about the event, nightmares, flashbacks, disassociation. So people say that they're almost in a mental fog. So that's kind of disassociation, numbing. We also find that again, so these things that outside of our ability to cope, our regular coping skills don't work. And so we might not be able to sleep. We might use substances as a result of trying to cope with whatever the event, has taken place. Eating disorders, people try to find ways to stay safe and stay in control. And over time, it becomes really maladaptive, and it no longer serves a purpose. So at one point, these symptoms are kind of considered survival skills. They helped you figure out how to survive in that moment, or maybe over time, if we're thinking about like complex trauma and things that happen consecutively, they helped to survive. And then at some points, we recognize that it is causing such distress in our lives that we can no longer ignore that, And so what we talk about is almost like if you think about, or if you just try to avoid it, not think about it. And I've always said, don't think about a pink elephant. Don't think about a pink elephant, like what pops in your head.
A pink elephant.
it. So that's kind of what the trauma symptoms do. So we try to avoid it, and then over time, you can no longer, essentially ignore those symptoms. They just become, just too distressing, and then that in itself leads some people to come to do some trauma work.
Yeah. Okay. I love what you said about how, like, it's a survival skill at first, because I talk a lot just with everybody, whether they're coming in for depression or anxiety or anything, about whatever it was in childhood that our 5 or 6 year old brain didn't really understand. We learned some kind of a skill to help us process that or move through that. But then when we hit our 20s and our frontal lobe's fully developed, now it's like, oh, that may not have been helpful now. Like, now I can look back and understand, maybe it's something that your parent said, and now as a parent you go, oh, like, that's why that happened. And so then we have to change our belief about whatever that was that happened when we were a child. And so I love that you mentioned that, because I think it's that specifically is a very similar process, because a lot of times we can create whole belief systems around that what is now maladaptive coping skill, but we think, no, that's what helps, or that's what I need. And so to be able to kind of go back and maybe disassemble that, or have more information, or for it to be normalized or validated. I think, like I said, I use that in my work all the time. So I love that you said that, because it sounds like it's not even necessarily specific to trauma, but that's kind of the human condition. Like, we're always trying to find that meaning, and sometimes it's through survival mode. So
yeah, absolutely. And and the thing with what you're talking about is, these survival skills, a lot of times, again, these serve a purpose. And what people don't realize is trauma survivors don't necessarily have memories, they have symptoms. So your symptoms tell me everything I need to know without you delving into details about your trauma. Because you just talking about these symptoms or how you survived tells me everything I need to know to help guide you to feeling safer, to empowering you, to coming up with better coping strategies. So this no longer takes over your life. Like, you are not defined by this event or series of events any longer.
Yeah, that's awesome. Oh, that's so good to know. So what are the major, I have a guess, but what are the major reasons people are afraid to work on their trauma? Is it that they're afraid to work on it, or is it that they don't maybe know that they need to? What's your take on that?
I think it's dependent on the person. And I know that's super vague, but a lot of times people don't come to to do trauma work because they are very, very scared.
Okay.
They don't want to relive that trauma. They don't want to have to rehash it with somebody. And I think that fear is sometimes what stops people. But really, my job as a trauma therapist is not for you to, again, tell all these gory details or all of these scary details.
Okay.
My job is to make you feel safe.
Okay.
And that's first and foremost what I'm going to do as a trauma therapist, is that I'm going to normalize what you're experiencing, because in the realm of trauma, everything that you've experienced is normal, given an abnormal event that took place in your life. So giving some education around that, understanding that you're not alone, and feeling safe is sometimes what helps people get in the door, just knowing that we're not going to, start right away and delve into anything. Like, I really want you to be safe. The other thing that I tend to see, and this is with more complex trauma.
Okay.
So, trauma that maybe started in childhood, and you've had a series of events, whether that's, abuse and neglect, domestic violence, community violence. So you have, multiple traumas. When you're an adult and you've gone through this, it's very scary to know, who am I if I don't have this trauma? Like, I've kind of embodied this. And so who am I if I no longer have to deal with this? And so we're really almost having an opportunity to relearn yourself and kind of carve out your own identity.
Yeah.
Yes, this will always be a part of your life, but again, you don't have to be defined by it, and it no longer has to control you.
Mm-hmm.
You can find ways to be able to control and empower yourself to move through these symptoms.
Mm-hmm.
So that's like, depending on the person, that's the biggest two things that I tend to see as to maybe why there's some reluctance to engaging in trauma.
Sure. Okay. That's good to know. So, that's part of the reason I wanted to do this is so that people could maybe learn about the process. That what I'm hearing you say is that people aren't going to go in on their very first session and like spill their guts about what happened to them, right?
Yes.
Okay.
Oh gosh, no. I don't do that. No, my first goal again is to make you feel comfortable and make you feel safe. And there's actually a lot that we can do because again, I'm not necessarily going to be focused on all of the specific details. That will come in time if you and when you decide you want to reprocess that. But my goal is to get you some relief over these trauma symptoms that are maybe taking over your life. So if you're finding hypervigilance, nightmares, intrusive thoughts, flashbacks, depression, anxiety, and this is what's overrunning your life, then that's what we're going to focus on, is managing that, and the thoughts that may be going along with that, and controlling that before we move into doing any kind of details or reprocessing.
Okay. Well, tell me a little bit about, I know there's lots of different modalities out there for trauma. I know for a while I did get trained in CPT and PE, and I know the VA was using that. They probably still are, just because things are slow to change, but
they are.
I actually remember, and I'll have you explain what it is, but I remember when EMDR first came out, none of the insurances would touch it with a 10-foot pole. I think they probably thought, even when you say the full name and like what it stands for, it sounds a little like hooey or mumbo jumbo, so I remember that. And because the insurance wouldn't pay for it, I was like, ooh, I don't know if I want to learn that or whatever. So tell me, I happen to know you do EMDR. So tell me about, what does that mean? What does that stand for? What is that?
So EMDR is, like you're saying, it's one of the modalities that we can use, and it stands for eye movement desensitization and reprocessing. Okay. Big words, but all it really means is that right now, because of the trauma, your brain has been rewired as a result of the trauma. And what EMDR does, essentially through either eye movements or what we call bilateral stimulation, which is, it's called a TheraTapper. You hold it and it's just alternating vibrations. So through sound, what we're going to do is essentially, either with the eye movements or the bilateral stimulation, we're going to distract your brain while you are reprocessing or thinking about your trauma. Because the goal is that with the trauma and the trauma story that you have, your emotions are all over the place because your limbic system is in overdrive, right? So like your limbic system is responsible for the fight, flight, freeze response. And what happens is we get stuck in that as trauma survivors. EMDR, the best way I could say it is that it helps distract your brain and create new neural pathways. So you no longer have the emotional response when you think about your trauma. So you can think about it, but you don't become overwhelmed by it. So it really does help rewire your brain, I guess, a little bit. That's the best way to put it. And again, EMDR has an 8-phase process. Okay. So obviously before anything, I need to assess and make sure somebody is appropriate for this type of modality. And so we're going to, do some assessment. We're going to do and make sure that you have some coping and grounding skills before reprocessing. And there's some scripts that we do. EMDR also has what they call resource installation. So I can essentially walk you through and create some resources that are already within you and draw those out. So when the time comes and we're ready to reprocess, you have things to fall back on. You have coping skills, you have grounding skills. You have, different interventions that you can be using as we do the reprocessing. So essentially, I always say, like, we're just going to help rewire you a little bit, and change the way that you think and ultimately feel about your trauma. And that's what can be so helpful for so many people, is that no longer have these strong emotions that are linked to this trauma. Yes, I can think about it, I can recall it, but it doesn't have the same hold as it used to.
Yeah. It sounds like, so I'm going to date myself. I remember back on, I feel like it was Maury Povich, but, probably 25, 30, maybe 30 years ago, he would do flooding. I mean, he didn't do it. He would have people on the show that, I just remember this one where this guy was afraid of birds. And so they literally just like put him in a room with like 30 birds, like parrots and cockatiels and whatever. But so it sounds like it's the opposite, but it has the same goal. It sounds like it's like a fast forward version. Flooding is like a fast forward. So it's rewiring just because you don't have time to feel all of that because you're submerged in it. Whereas EMDR, it sounds like it's a slower process, using kind of the rewiring of the brain is kind of a slow and steady rewiring, so that it you said 8 phases. How long does it take usually to kind of get through that process?
It depends on the kind of trauma that somebody has. So I do a lot of work with trauma survivors who have really complex trauma. So they might have childhood trauma, they might have adult trauma. And so depending on, and again, you're like, as the client, you're in the driver's seat as far as what you want to focus on. So if there is something, a memory or an event that you really want to focus on, you can start with that first. But what tends to happen with EMDR is that as you do the reprocessing, when you get ready for that, you may find that other memories start happening. And so you might have a targeted memory, but maybe a childhood trauma comes up for you. And so as an EMDR therapist, when I'm checking in with somebody, if they can verbalize it, great. And if not, that's okay too. But I just say, hey, are you okay with going with this? Because eventually, we're going to be able to reprocess probably more than you realize if you've had complex trauma. So you might have, multiple phases of EMDR reprocessing, just depending on how complex your trauma is. A single event trauma. So for example, if somebody had an assault, they've never had any other trauma, that might be a whole lot shorter of a intervention than somebody who has had multiple traumas. So, at least, again, the outcome is hopefully going to be the same in the sense of you don't have the same kind of emotions attached to this memory or attached to this trauma, regardless of complex or single.
Okay, awesome. Now, obviously, this is a specialization of yours. What kind of training did you have to go through? Is this something that most people have? How would I, know if the therapist I was talking to had been through this training?
So for me personally, I started with children and adolescents and doing trauma with children and adolescents. So there's a modality called trauma-focused cognitive behavior therapy, and that my training was through AGH, so Allegheny General Health. So they have a Center for Traumatic Stress that's run by Dr. Manarino, Dr. Cohen, and I am so sorry, I cannot remember the third doctor's name, but they literally wrote the book on this. And that's really where my experience started. So I did the TFCBT training. I went to training with Dr. Manarino, and then we were consulting with him on a year-long basis, getting training and supervision with him while I was, with the agency that I was working for at the time. So, that's something that was very, very helpful. So as I continued on and did trauma work, so I had that certification. And then with EMDR, I went through, there's a level 1 and there's a level 2 EMDR certification. And so, you can stick with just level 1. Level 2 is a little bit more advanced. And there's a little bit more to level 2, but you would need a certification to be able to do EMDR. Like you need to go through that 3-day training at the very least in order to move forward.
Okay, good deal. You know, clearly you do EMDR. Why do you feel like, and I'm not saying that you have to pick one, but do you feel like that is the most helpful? Like, does it reach a broader spectrum of clientele? Does it just help with more general trauma? Like, why did you pick EMDR over maybe some of the other modalities out there?
Yeah, so what I tend to found is in doing research, you know, in looking at EMDR, it's obviously, you know, directed for trauma, but you really could use it for a broad range of diagnoses. So severe anxiety or depression, you know, there's some things that you can do that EMDR can be very helpful with. So when choosing like a specific, I guess, like intervention, you know, EMDR is certainly can be broadly used, you know, with not just trauma, but with, you know, other types of mental health issues. So for me, anyways, I felt like it was very, very important to get that certification. So I can not only treat trauma, but if somebody was a good candidate, but maybe they had some significant anxiety or maybe they had some significant depression, that intervention could be helpful for them as well too. And so, you know, depending on that intake and that assessment, maybe EMDR. So I have had some clients say, don't give me EMDR. I don't want to do it. Okay. We can do something else then. And so part of that training with Dr. Manarino or getting supervision is really learning and understanding the different modalities and what's, you know, what can work and what's out there in regards to, you know, doing trauma therapy. So just being well versed on a variety of different techniques, just because I've had some clients that say like, it was, you know, I've had it in the past. I don't want to do it again, but I'm still feeling this trauma, you know, this keeps coming up for me. You know, can you do something different? Yeah. Let's, you know, take a look at, you know, what's worked for you and what hasn't, and, you know, come up with a plan from there.
I love that. I'm always telling people who are looking for a therapist, like, it's okay to shop around. Like, it's kind of like, buying a new car. Like, you may not fall in love with the first, that's probably the wrong terminology, but like, you know, you need to find a right fit. Like, you need to be comfortable with the person that you're sitting across from. And so I like that. And I always tell people, like, you know, make sure you come in with a list of questions if you know what you're looking for, to make sure, and that no therapist should be offended if you feel like it's not a good fit. Like, you know, as therapists, we want people to be able to get help. And that part of that is finding someone that is a good fit. And so I always tell people, like, just come in once and let's see how it goes. And if this isn't a good fit, then I'll absolutely give you some referrals. I know some other great therapists, and let's see if we can find a good fit. So
yeah, absolutely. Because, and that's like, I know for myself, like I do a 15-minute consultation. So if somebody's interested, I want to get you, you know, on the phone and just talk to you. I always liken it to a pair of shoes. Like, you kind of sometimes have to try on a couple of pairs before you get to the right fit. And so absolutely, you're well within your rights to shop around, to ask questions, and make sure you're comfortable, especially if you're going to be doing this kind of work or you're willing to do this kind of work, because sometimes this is long term. And so it really is making sure that you have a really good therapeutic relationship with whatever therapist, you know, you decide to go with. Yeah,
no, I totally agree. Now, what about, is EMDR good for kids? Is it safe for kids? Has it been studied with kids? How old do you need to be to really kind of start working on your trauma? And is it okay to do it when you're like, you know, if your parents went through a divorce and, you know, like you're 5 or something like that?
Yeah, there is some techniques that you can adapt for kids. I would say depending on how young they are, EMDR might not be the best fit, especially younger kids. When you think about trauma, and depending on when that trauma happened, if it was prior to learn like language, if it was prior to that, even if it was, you don't sometimes have the cognitive ability put words to an emotional experience.
Right.
And for kids, they might do better with like play therapy and processing that way, or they might do well with the TFCBT, because there's things that we can do. TFCBT is very collaborative with the parent and the child. And so you're really not just, helping the child, but you're really helping the parent gain some understanding around trauma, getting the skills themselves, as well as the child. So it's very collaborative in nature. So that might be a better fit. For some of my teenage clients, it sometimes depends. If they are, sometimes they're very up for it and they find that it's really helpful. Some find it, I've had some teenage clients are like, that's just weird. I don't want to do that. We don't have to. And we're not even processing. We're just kind of dipping our toes into doing some imagery and using bilateral stimulation. So, hey, how did this feel for you? And if it wasn't a good fit, then I know to go on to something else. But they usually have to be a little bit older, to really get the benefit of EMDR. And like I said, you can certainly adapt, but there's probably better modalities, depending on how young that child is or, or that kid. So.
I actually did an interview yesterday with a colleague who does play therapy. And so we were talking about that same, like, if they don't know how to put words to their feelings, they're not going to be able to sit on a couch across from a therapist for an hour and talk. And so we kind of just explained what is play therapy and how that works. So no, that's good to know, because I guess you do need to be able to be thinking about what your image is when you're reprocessing that. So that makes sense. Okay. I often, as a therapist, I feel like I am the lucky one because I'm witness to the progress that people make. I had a young lady today and I was just like, I think I've been seeing her about a year, and I was like, oh my gosh, do you know how much better you are? And she was like, oh, I'm so glad you said that. She's like, I feel it. But tell me, how have you got to see people's lives change? What have you got to experience, and what are some of the changes you've been witness to?
Yeah, this therapy, specifically trauma is so empowering, and to see somebody, begin to change and evolve and to really come into their own power, I guess, is amazing. And I feel very grateful for having the opportunity to be on that journey with somebody, because I know that, this work is not easy, and it is a lot of work. And so, but in seeing this, I've seen people just absolutely thrive in the sense of, thinking not of just one particular client, but so many clients that come in. And again, these symptoms are hijacking their ability to cope. They are, not able to be fully functioning. And so doing this work and being able to see these changes and ultimately how they feel about themselves. I mean, I think that's the biggest and most powerful aspect of this, is that a lot of times people are coming in with so much shame and guilt over what happened. That shame and guilt keeps people stuck. So to see that people are moving through that, to see that people are finding worth in themselves, finding evidence to say that, like, I'm deserving, I'm worthwhile. And they've gone on, I've had some clients go on and be very successful in life and being very successful in being able to be productive members. And again, they know when things come up or, an anniversary or something, they know how to deal with, whatever's going on. So
yeah, that's awesome. I do. I feel like we're the lucky ones a lot of times,
Yeah, absolutely.
Is there something that people maybe should work on before they do their trauma work? Or if they've never had therapy before, and they, get to a place where they decide they really need to work on it, do you recommend that they do some other stuff before they jump into trauma work? Or what would you say to that?
I would say, I think that if there is something, therapy can't hurt. You know what I mean? Doing a little bit of therapy can't hurt. A lot of times what we do, though, is prior to even delving into trauma, again, it's making sure that somebody feels safe enough.
Mm-hmm.
But the other big part of trauma work is really taking a look at your belief system, really taking a look at how you're viewing the world, yourself, and others, and beginning to start to change that. And sometimes once that starts to change, that reprocessing is a little bit easier, or we might find that through the reprocessing, that belief system starts to change as well too. So that's another really cool facet of this, is that if somebody wants to start, but they're not necessarily wanting to necessarily start with trauma work, that's where we can start, is like, yes, let's get these symptoms kind of managed, but really let's really become curious about when they're coming up for you, and let's get curious about how you're viewing the world and how you're viewing yourself as you're moving through this, you know. So that's usually a nice place to start. So if somebody wants to start there with a therapist, you know, that could be a great stepping stone to getting into trauma therapy.
No, I love that. I think, you know, I think as therapists, we sometimes don't even know that we're doing that, but no matter what someone's coming in for, I'm trying to assess, like, at what level of crisis are they at? So even if it's like marriage counseling, if they're like going to sign divorce papers tomorrow versus, oh, we're just fighting more than normal, you know, like, sometimes we don't just go back to the beginning and say, okay, like, how did all this come about? Sometimes it's like, what do we need to do this week to keep you safe and to keep you okay, without, you know, making any rash decisions. And so I think that first session is so important, with just like, okay, like, what is the plan from here? Where are we actually today, so that we can try and figure out a plan. So I think that's important to know. And I love, you were speaking my CBT love language there, about, you know, how you see the world and yourself and others in the future. And I do all kinds of that in my session. So no, I totally get what you're talking about, and how I agree. Therapy's most likely not going to hurt if you go to someone who's competent and knows what they're doing. I was listening to a podcast, and the person was talking about, you know, everyone should go to therapy. And then she did give a warning, and I was thankful that she said this. She said, but sometimes it gets worse before it gets better. And I was glad that she said that, because I think a lot of people, and tell me if you've seen this too, like, they drop out because it does get hard. Like, it's hard to change some of these lifelong engraved, you know, thoughts into our brain. And it's hard to give up. If this negative coping skill has always been there for you, and it's been your best friend, and it has become part of your identity, it's scary to think, oh, like, I what am I going to do without that, you know, and that there's these other things that I'm going to learn that they're going to be even better. Like, that's hard to believe when you've had this other thing. Compulsive overeating or binge eating, that's something we talk about a lot, and it's hard, you know, when food or sugar has been that thing, has always been there for you. It never judges you. It actually gives you a surge of serotonin. It makes you feel better for a minute. And so it's scary to kind of dissect that, because it's like, well, I don't want to give up this thing that it's kind of helped me survive. And so, you know, I always try and warn people before we do any like really deep, hard work like that you will be okay. This may suck for a little bit, but you will be okay. And I promise it can be better on the other side, but you have to actually do the work. And I know that's so hard, because when you've already been through hard things, you don't want to think about going through more hard things. So
absolutely. No, I'm glad that you said that, because when I think about trauma work, I think about, sometimes you have a gunshot wound, right? And it's bleeding, and it's you know, it's profuse, and putting a Band-Aid on it isn't going to work.
Right.
My job is to clean it out.
Yeah.
So and my job is to clean it out with you, and that's going to be hard.
Mm-hmm.
You know, and I don't sugarcoat things, you know, either, in the sense of like, you know, I know it sounds so cliche, but the only way to move through this is to literally just move through this. You can't go around it.
Yeah.
You can't find, you know, there's no shortcuts to this.
Yeah.
we just have to go through it. But I promise you, once you clean out that wound, you're going to feel so much better.
Yeah.
But it's a process, and just know that that process is going to take time. And then we talk a lot about also self-love and self-compassion. Have that for yourself as you're going through this process.
Yeah.
You know, because people get the shoulds. Well, I should be better. Like, I should.
I say that too. Quit shitting yourself. I say that all the time.
Yeah. Tell me why. Like, just let's get curious about it. Tell me why, because, you know, and what evidence do you have to support this? You know, because by all accounts, the level of resiliency that I've seen in so many people has carried them through this. And sometimes they don't see how far they've come until we do take a step back and we like, hey, do you remember 6 months ago when like this is where you were? And like, look at where you're at now. And like, yes. And was this hard? Yeah. And is it going to get better? Yes. I promise you that, you know, we're going to continue to work and get you to where you ultimately want to be, you know, your life, you know, and being able to move through this. But yes, it's going to, you know, it's going to get hard.
And also, and I'm sure you would subscribe to this too, but like that they are in control of the speed and the pace, and yes, you will challenge them and push them when they need that, but that you're not going to push them so far or so fast, because that's actually another definition of trauma I heard once, and it was just too much too fast. And I was like, ooh, I like that, because that we all understand with that. It's kind of like trying to drink out of a fire hydrant, right? Like, you can't. And so I really like that. And just, to remind them, like, I often tell people it's kind of like, don't save the can of worms for the last 10 minutes, because once we open a can of worms, I tell them it's my job to try and make sure that you're safe to leave my office. So if you wait till the last 10 minutes, that might not be enough time to get all the worms back in the can and put the lid on it so that you can take it with you and bring it back the next week. And so, but I think that is, you know, along the lines of what we're talking about, is that, you know, you really can direct. And, you know, I have some clients that they might have a week where they feel like, I don't know if we talked about anything important. And it's kind of like, because I sensed that you needed to breathe, and I sensed that you probably wouldn't have been able to go deep today. So, you know what, we stayed in the shallow end a little bit, and that's okay too. Because sometimes, again, I think people who have complex trauma, they're so used to it that they don't know that that's not I'm using air quotes. I don't know if anyone can see my air quotes, but that's not the norm, in the sense that you don't have to keep having trauma after trauma after trauma in the times that you can control that. And so, I think sometimes it's, as therapists, we can help them self-regulate in that way too. So.
Yeah. And to bring that up, I think what tends to sometimes happen is that when people get fearful of doing this kind of work, in TFCBT, they call it COWS, crisis of the week. So what people end up coming in is like, oh my God, let me tell you about just this week in the here and now, and let me tell you everything. So we never get to the deep. And so it's a way to kind of protect themselves from doing the hard work. And so again, like you're saying, once I kind of noticed that, it's like, okay, let me just share my observations with you, and let's see, you know, like where you're at. You know, again, my job is to help guide you. So this is a dance that we're doing together, you know, and, you know, there's, like you said, there's going to be times where I bring some stuff up that maybe I'm noticing for you. And then, you know, there's going to be times that I let you be where you're at, you know, and recognize that, you know, this is the limit right now, and that's okay. That still works at the end of the day, you know, so. Yeah.
Awesome. Well, Courtney, thank you so much for your time and for your information. Is there anything else that you feel like we should mention? Did we cover everything? Is there anything major that we left out?
I don't think so. Not that I can think of. The only thing that popped in was, if people do want to learn more about trauma, there's some cool books out there.
Awesome.
So Bessel van der Kolk. He is a guru in trauma. He has a book, The Body Keeps the Score.
Yeah.
Fantastic and it's very relatable. Peter Levine has some books. And a really easy read is called Waking the Tiger. And so he talks about that, and his intervention is somatic experiencing, which is a different modality. Okay. So, he talks about that. But there's those first two books, and I know I'm missing a lot, but those first two popped into my head. Janita Fisher is another really wonderful trauma expert, and her website has a ton of wonderful resources. If you ever want to just take a look around and, and get curious about what else is out there. Yeah. So if people are interested, those resources are there.
No, I think that's great. I do always tell people to do their research and to look around and figure out, because like you said, EMDR may not be for everybody, especially if they have maybe sensory issues anyways. Feeling something like that may, be too much or overstimulate. And so I always tell people, like, do the research, call and ask questions. I don't know a therapist out there who, if you called and just said, I just have some questions before I call and make an appointment, that wouldn't sit there and explain to you or answer your questions. And so I highly encourage that, because kind of going back to empowerment, that empowers you to know, right? And applied knowledge is powerful. So no, I think that's great. I actually have The Body Keeps Score in my stack of books I'm gonna read, and that stack unfortunately keeps growing, but it's definitely in my list of ones that I need to get to sooner than later. So
yeah, there's some good ones out there.
Thank you so much, Courtney. Again, y'all can find Courtney at Kirkpatrick Counseling and Consulting here in Pittsburgh. If y'all have any other questions, let me know, and we can definitely get those answered for you. And again, thank you so much for your time and imparting all of your knowledge and information onto us in this relatively short interview. So I really appreciate it.
Yes, thank you for having me.